enter the room.
Hello, my name is Dr. Rusazafar and my GMC number is 82222. May I proceed?
Please proceed.
Hello, my name is Dr. Rusazafar and I'm one of the doctors in emergency department. Can you please confirm your name and age?
Hi, doctor. I'm Amber. I'm 15.
So you're Amber Shelley, right?
Yes, that's correct.
Okay, so Miss Shelley, what brought you in today?
Well, doctor, I have been throwing up since morning, and my parents insist that I come in to the hospital and get it looked at.
Okay, so how many episodes of vomiting?
Well, since morning, it's been like
Mm-hmm.
about 2, 3 times, I guess.
Okay, and have you noticed anything that's making this vomiting better or anything that's making it worse?
Oh, I have no idea. I just, just vomit all of a sudden. I don't know what's making me feel this way.
Okay,
It's
any
better.
tummy pain, any diarrhea?
No, not really.
Okay, so can you tell me, is it getting worse with the time?
I can't really tell whether it's getting worse, but yeah, I've been feeling, nauseous since morning. So yeah,
Okay,
doing that
and
constantly.
let's talk about a little bit about the content. Is it bloody or is it like it just contains the food? Yeah, what does it look like?
Well, mainly my breakfast, whatever I eat, feels like I
Mm-hmm.
can't put anything down.
Okay, so there is no blood in the vomiting, yeah?
Oh, no blood. No.
Okay. Have you experienced any dizziness, any vertigo?
No, doctor. But I
Nothing.
feel
Did you?
very weak.
Yeah.
But
Mm-hmm.
I feel very weak and tired.
Oh, okay. 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 So, yeah. Can you please tell me any earache or any tummy pain or any pain while doing V?
No, no, not really, doctor.
No, really. Okay. Um. So, Miss Shelley, I'm going to ask something about your previous medical history, okay? Did you experience something like this before?
No, it's the first time I'm feeling this way.
Okay, okay. And can you please tell me, are you suffering from any medical condition, any like diabetes, anything?
No, doctor, I've been very healthy.
Okay, good. Okay, and have you used any medicines or using any sort of medication?
No, not really.
Okay. Are you allergic to something?
No, not that I know of.
Okay. Have you traveled so far?
Traveled where?
Mm, go to another city, maybe change of environment, yeah?
Oh, no, no, I've just been around. No.
Oh, okay, that's all right. Okay. And yeah, you're okay, well, tell me about your diet and exercise. What did you eat last time?
Oh, well, I just had breakfast. I had toast in the morning, and that's
Mm-hmm.
probably, yeah.
Oh, okay, okay. And do you do exercise?
Yeah, I'm into sports, especially in school.
Okay. So, a little bit, do you smoke or do you take, by any chance, it just for the purpose of consultation, I'm asking these questions. So, do you take any alcohol?
Oh, no, doctor, I'm
Okay,
underage.
that's great. That's great. So, yeah, Shelley's mom and dad, for the purpose of consultation, I usually have some time with my patient alone. Would you be okay to go out for some time?
Sure. Parents have left the room.
Okay, so Shelley, I'm going to ask some question that might sound intrusive. Can I proceed?
I guess, yeah.
Okay, Sally, how was when was your last period?
Um, I don't know. I guess some 6 weeks ago. I guess, yeah.
6 weeks ago. That's a bit long. And can you please tell me, are you sexually active?
Um, I mean, if I tell you this, will you tell my parents?
Shelley, our conversation is confidential as far it doesn't involve the safety of anyone. So you're completely okay. Please tell me.
Um, yeah, I am.
Okay, so do you have multiple partners or do you have just one stable partner?
Actually, it's my boyfriend.
Okay, so how old is he?
Oh, he's my classmate. We are from the same year.
Okay, okay. So by any chance, does is you're willing, yeah, you're willing to do that. By any chance, did he force some, or did he control you doing that?
No, doctor.
No,
I mean,
okay, okay. So I'm gonna examine your, check your vitals, examine your
2
tummy,
minutes remaining.
and order some blood tests for you, including the pregnancy test, urine test. Is that okay?
sure.
Okay. So, Shelley, well, we've tested you for the pregnancy, and what I found is that you are pregnant. And this could be a morning sickness. It's normal in the first trimester of pregnancy.
Oh my God, doctor.
Yeah, yeah, this must be overwhelming, but yeah.
I don't know what to say. I feel so scared right now.
Shelley, you don't need to be scared, okay? Um, just I'll give you time. You can think about it. We can discuss about the options. Right now, I can refer you to your GP and some advisory services. Then you can contact them, and just so you know, we will decide gradually about this. Will that be okay? I know it's a huge information to process, so yeah.
Will you tell my parents?
Shelley, we would involve your parents only after you tell us to. But but from my side, I would really suggest that you should involve your parents, your boyfriend. Is that okay?
What should I do? Should I get an abortion?
That's completely your choice, Shelley. I will give you the leaflets, and just for your vomiting, I'm gonna give you the anti-sickness medicine cyclizine for now, and
Move on to the next station.
okay.
Yes, all right. Yes, management, there is a lot to ask. I understand, definitely. So, I think I would give you a lot of, a considerable amount of marks for safeguarding. That's very important in this case. So they are making sure that you do safeguard. So make sure to be safeguarding in this kind of a case. And you are going to run out of time. One advice I'd like to give you, Dr. Rusa, you are interrupting the patient a lot. Let them finish before you start asking the questions, right? Maybe I was trying to give you some more information sometime, but you seem to be cutting me off before I finish, right? Don't do that, because you will get marked against, you would be marked negatively for that. You would get a tick for listening as well. So let the patient express themselves. I know you're running out of time, but that's not something that you have to show to the examiner. Right? Let the patient have a conversation, because the examiner is trying to see the direction in which you take your conversations, your consultations. If you're able to, make sure that you're involving the patient in the decisions that you're making. So even the breaking of the news was very abrupt. So that's one thing that I want to tell you. So from the urine pregnancy, it looks like you are pregnant, and the vomiting that you had is a consequence of that. It's called morning sickness. You see, it's very abrupt. You're talking to a teenager who's like 15 years of age, who's just kind of just, at this point, just explored her, what to say, just started with her sex life. So you can also ask that question, how long have you been sexually active? Do you use any contraceptions, right? So then that will give you an idea of, all right, this could be heading towards pregnancy, right? But still, what you want to do is you want to break the news to her, not just abruptly present it, right? So what you're trying to do is you're trying to, give her a little bit of what she understands to the point that she doesn't. So from what you have told me, and the examination that we've done, yeah, it looks like there are heavy indications towards the fact that you could be pregnant, right? And and then wait for a reaction, because that's a very heavy news. If you're going to drop a very heavy news like that, give them some time to process it before you actually bring in the vomiting aspect of things, right? Let them process it a little bit and then talk about the vomiting a little bit. So basically that's where your interpersonal skills comes in, right? Your thing, what is the more the more what to say, difficult diagnosis to process, the pregnancy or the vomiting? Definitely the pregnancy, right? So give them that time to process that information before you talk about the symptoms that she is experiencing. Right. So if you're dropping the pregnancy, definitely, give them some time, or else you can start with the vomiting part. So since you mentioned that you have been experiencing vomiting, and from what you have told me and the examinations that you have done, it looks like you're pregnant, right? So end with that and then give the pause, right? So that you can actually bring all the information together. So when you're actually breaking the news, you have to break it in a way that it gravitates towards towards the end, where you say that she's pregnant, so that you can give her the time to process that information. Does that make sense?
Yeah, but the time is so less for all this.
Absolutely. I mean, these are stations where mostly, how you conduct the stations matter a lot. There are stations where you would be actually dealing with, learning difficulty patient, and that patient will just keep asking you questions over and over again. And you are required to be patient and answer these questions. Even though these are stations where you will not be able to finish your consultation, what the examiners are trying to see is how you conduct it, right? Your decorum of conducting it, so that if you were to do it in a real life situation, it wouldn't end up in a lawsuit, right? That's the main thing, that you need to maintain a certain what to say, demeanor when it comes to talking about such difficult cases. um, all right then. We'll just quickly go through the results. So this time's results, I'll just share my screen quickly. So, guys, some ways where you can actually, express how you have to talk and how to cover this station in 8 minutes. So we have the consultation guide on, the workbench that can help you take from one section to another. Every 30 seconds, you can actually have this consultation guide running.
Begin. Enter the room.
That can guide you on the flow of the consultation that you need to maintain. So we have made this consultation guide for every case, every scenario, and we have a couple of free scenarios that you guys can check out, and we'll just drop the link for the workbench where you can access the cases. And for everybody who has been attending our calls, we are offering a 20% discount on any of the workbench products. So as you see, it just went from one section to another after every 30 seconds. So this is a good guide to actually guide you on how to do the entire case in 30 seconds. But always, if the patient is talking, let them talk and make it a conversation mostly, right? Make sure to address the main aspects of the conversation. So even when you're reviewing the this conversation, what are the things that jump out, especially making sure that you should have done in this kind of a scenario? Number one would be safeguarding. Number two would be giving them the options of what they can do. Number three would be advising them to involve their parents, right? So remembering the fact that they are a minor at this point, right? So even when you think about this case, think about all the different important aspects that you need to have mentioned, or you need to somehow incorporate into this consultation. So definitely this is one guide that can also help you in do that. All right then, so let's quickly look at the results for the second attempt. All right, so data gathering, you did a great job. Let's see. So confirm Amber's full name and age, presenting complaint. Can you tell me what brought you to the A&E? Explore vomiting in detail. Ask about onset frequency, content, amount, and timing. Ask about associated symptoms like headache, dizziness, ear pain, abdominal pain, diarrhea, and urinary changes. Explore past medical history. Ask about any prior similar episodes or chronic illnesses. Medication and allergy history. Ask about current medication, over-the-counter use, and any known allergies. Ask about travel history. So that question kind of came out a little odd. Have you traveled? Like frame it in a way that it would actually mean something, right? Have you traveled anywhere recently and eaten any exotic food? So that sort of a way where they actually understand what you're trying to say, even though what's going on in your mind. I understand what you're trying to ask, but I wouldn't give you that clue. You have to understand that the patient needs to understand what you're trying to say, right? So you need to phrase it in a way that they understand it right away. So that was something that I noticed. Recent travel history. Ask the parents politely to step out to ensure confidentiality for adolescent-specific history. Reassure the patient about confidentiality by explaining. See, that's again the confidentiality. You have to offer them confidentiality in order to get those information out, especially when they're hesitating. Tell them the circumstances and the limitations of the confidentiality as well. Right, so that is something that try to practice that the wordings of it, because those are very important words. So the most simplest way of saying that is everything will be between you and my team until everybody is safe, until we do not identify any serious danger to you or anyone else, right? Menstrual history. Ask about the last menstrual period, regularity, duration, and any changes. So even though you identify that LMP might be 6 months, 6 weeks, think about asking, does she have any other underlying conditions that could be causing that? Right? Like, are they usually are they usually regular? How long are your cycles? Right, rather than completely jumping into that scenario. But even if you don't have time, if you think that you need to move along, that's okay, because you'll be doing a UPT as well. Assess sexual history and contraception use. Yes, contraception is missed. That's very important. Like, what is the contraception type that she's using? This is also a very important aspect when it comes to this case. Why? Because you're trying to avoid any future instances of this happening, right? So understanding her current contraception practice is very important. Like, what is she using for contraception, right? Does she know that there is something like contraception that you can use in order to avoid pregnancy? That is something you need to understand. Does this child understand this, right? Especially since she's being sexually active.
Yeah, even if you're not able to ask that in the data gathering, make sure you bring it up in your management at least. So bring up when you speak about leaflets. You can also put in a point about I'll give you leaflets about different contraceptions you can use in the future and things like that. Because if she does get the abortion, immediately she's at a risk of becoming pregnant again. So you need to prevent that. So that's one of your important points in your safety netting for management as well.
Yeah, absolutely. All right. So sexual and safeguarding history are sensitively about sexual activity, number of partners, contraception use, partner's age, relationship status. and coercing or consent concerns. Ask about psychological history, including school life, dietary habits, exercise routines, smoking or alcohol. Definitely signpost when you're doing that. Perform a general physical examination, including assessment of dehydration because she's been vomiting so much, right? Vitals, such as temperature, pulse. Temperature is also a very good question to ask to rule out infection, because as soon as you're thinking vomiting, you're thinking about a GI infection. So that's also a very good question to ask. Have you been feeling feverish lately? Right? Do you feel, you've been running a temperature? Have you measured it? Right? Perform focused physical and bedside assessment, including abdominal examination, urine pregnancy test, and urine analysis to evaluate for pregnancy-related causes, UTI, or dehydration. Explain diagnosis clearly. Yes, Dr. Chavi, you have a question. Go ahead.
Hi, sorry again. My question may sound silly, but regarding like patient is 15-year-old, and we know, I mean, the flow of the consultation, we know that she has the competency and everything regarding the decision for her pregnancy or any other health problem. But do we mention anything regarding like Gaelic competence to show the examiner that this question we are asking her?
But how do we know the competency at this point? How do we know that she's competent? What indicates the fact that she's competent? How did you get
that's
that?
why. I mean, how do we ask her that directly? Because since the flow of the consultation, we are taking into consideration that she has the competence. Because
Right.
the
So
pen is to go out. We are
about Gaelic competence. When do you offer the Gaelic competence? That's the important question, I would say. Dr. Vigdan, do you want to add on to what Dr. Chavi said, or do you have another?
No,
You-
I just wanted to add on. When we started the conversation with her, and look, as we are so far in the conversation now, so we know that she have the Gaelic competency. And the other thing is that we can ask the patient that, are you happy in this relation, and do you know what you are doing? Which means that she understands what she is doing, what she has already done. She knows that, because when we start the conversation, and if she's answering all like sensibly, it means that she understands what she was doing.
Yes, I
Correct.
mean, yeah, that's what I.
Wait, hang on, guys. I just
Sorry.
want to interrupt that. So at no point do we know that information. We do not know the consequence of her actions. We do at no point do we know what if she knows the consequences of her action. That is what Gaelic competence is, right? Gaelic competence checks what you're doing. You know what you're doing, what will happen if you don't take precautions. Yeah. And you don't know, what are the precautions that they're taking. At no point you know that. So you have to ask the question. And at this point, Gaelic competence doesn't even come into play, because what needs to happen has already happened, right? You do Gaelic competence in order to actually give the contraceptions.
But
Does
we
that
are
make sense?
sorry for my interruption. But we are like leaving the decision uh, regarding her pregnancy to her, right? If as the consultation is telling us that we are asking the parent to go out, and we are telling her that we will be referring to, or we will leave this thing to GP, that he will assess and do the things accordingly. I
All
mean,
right.
that's what my question was. Do we need to like this into consideration, or just ignore it completely?
I understand. So when you're talking about Gaelic competence, doctor, you need to understand that you're doing that to give contraception to prevent pregnancy. Over here, this case is pregnancy has happened. It's already happened. So now it is her decision whether or not she wants to continue the pregnancy or not. That is a decision she has to make no matter what. Right? Moving forward, this is a state that she cannot go back and change. This is a state that has happened. From now, from this point on, you need to make the decision on how you want to continue. Right? So we are giving her the choice of what she wants to do. Right? At this point, whatever she wants to do, we are not looking at competency at all. right? We will be explaining to her the, what the decision involves. If she wants to continue, we will be telling her what that decision means. If she doesn't want to continue, we will be explaining to her what that decision means. What would taking competency, doing a Gillick competence mean at all in this case? Right? Like, you will be informing her, because at this point something or the other needs to happen. Either she continues with the pregnancy or she, terminates it. So we'll be explaining to her whatever, would be the consequence. I see there are a lot of hands that are raising. Dr. Sana, I would give you the first chance, and then after that we'll go with Dr. Abayodun, I guess. I'm so sorry if I'm butchering that name. Dr. Sana, please go ahead. You have something to add.
I want to say that I think some people are confusing Gillick competency with mental capacity.
Okay.
So that's
why
why it's looking difficult. That
Okay,
mental capacity is something different.
Okay. All right. If you guys are, if that is something that you guys are confused about, it's entirely different. Definitely, Gillick competency is basically done for underage, people to actually give them contraception, right? In order to understand whether or, because they are going to be sexually active no matter what. So to understand the consequence of their actions, do they understand the consequence of their actions, and what will happen if they don't take, the contraception, and safeguarding them against the, the complications and the related consequences, which has already happened in this case, by the way. And we don't even know if she's using contraception, right? So that's a good question to ask, so that in the future, to prevent it from happening, we can actually tell her how to do that, how to prevent it from happening in the future. Right? Yes, Dr. Abayodun. Am I saying that right?
Yeah, you tried. It's pronounced as Abiadun, but that's fine.
Okay, Dr.
What
Abayodun.
I was going to talk about the Gillips competency, because what I used to know is that it's meant for people below the age of 16, but are more than 13, just to know that they have the mental capacity to take their own decision. But initially you said it's of no play, because they still need to make decision of whether they're terminating or not, and if the patient is below 16 but above 13. I think Gillips, you still have to do Gillips, because if they're below 13 years, then you need to talk to their guardian or their parents. They can't take that decision. You can't terminate,
Okay, right.
except it's for a medical
At no
reason, or is going to affect the patient mentally. That's all. That's what I was going to ask, whether it's the same thing or not.
All right, so thank you for that question. So understand the situation that this patient is in. So when you're trying to assess for competence, right, Gillick competence, at no point, the decision, at this point, they are, underage for sure, but they are sexually active. So when we are talking about Gillick competence, we are trying to understand what is their take on the activities that they are doing, right? Like, what do they think is the consequence of that activity, so that we understand how much they understand about the situation. So it's basically to understand their competency, so that if we actually tell them about the precautions, how much are they able to gauge, right? How much are they able to, understand the consequences of the decisions that they are making, right? This is a scenario, understand the scenario properly. So this is a scenario where the patient is already pregnant. So when you are going to be explaining them the complications, that is a part of informed consent, right? When you're trying to do the abortion, if that is a choice that they have to make, whether or not to continue with the pregnancy or terminate, because from this point, after getting pregnant, either one is going to happen. They cannot go back to a state where they are not pregnant. They are pregnant at this point, right? So now, whatever the decisions they will be making, they will be explained the consequences in the form of an informed consent, right? If they're doing the procedure, it's not assessing Gillick competency. All right, I'll I will link out a video that we have made on Gillick competence and Fraser criteria for you guys so that you have an understanding. And Gillick competence is mainly done for contraceptions. All right, so when you're talking about Gillick competence, it's yes, Dr. Chabi is also mentioned. Gillick is not only for contraception. Yes, it's mostly used for contraception. Basically, it's to understand how much a teenage or an underage person understands a certain situation, right, and makes the choices when given. Because what you are trying to do is you're trying to understand if they are in a position of danger. Are they being brainwashed, or are they being coerced into a situation that they do not understand, right? So when you're talking in for a contraception, basically that's what you're asking. What do you understand? Is this something that you are making your mind, you are understanding what happens and doesn't happen, or somebody has just told this to you and you're just believing them all because they are in a position of power, right? That's what you're trying to gauge. As a doctor, when you understand a teenage person has actually come, or an underage person has come to ask for contraception, you need to understand the position and the situation they are in. And even though you cannot control their actions of having sex or not, you can still keep them protected by making sure that there are no unplanned pregnancy, because that will end up becoming a more of a complication. Does that make sense, guys? Is there any other questions, any more discussions regarding this topic? Dr. Abiodun, do you have anything else to add? Your hand is still raised. No. All right, Dr. Asha, you have a question. Please go ahead, ask.
No. Okay, that's fine. Thank you.
In fact, I'll make a blog on this, and I'll do some more research, especially when it comes to termination of pregnancy, on and Gillick competence. What is the correlation, if there is any correlation, or if it is informed consent, or if it's Gillick competence. So I'll do a little more deep dive into that, and I will make a blog, and I'll link out the sites that I have researched as well, so that you guys can also do your research on your own as well. Yes, Dr. Aisha, you have a question. Go ahead.
Yeah, doctor. I have a question. Like, if her partner is of her same age, it means there's no need to involve in safeguarding, okay? And she is also having the Gaelic competency. So in that case, we just say that it will be better if you involve your parents, if you inform your parents about your relationship. But now the second case, if there is no any safeguarding concerns, means her partner is of her same age, but she has no Gaelic competency. It means when we ask about her, like, do you have any knowledge related to the contraceptions, or what will be the consequences, she doesn't have any knowledge regarding this. So in that case, whether we will maintain the confidentiality or not, like whether we force her to inform your parents or whatever, like I have this.
All right. Good question. But at no point do you understand if the patient has Gillick competence at this point. It's too late to ask for the Gillick competence yet, because the complications already happened. What you're trying to prevent by asking Gillick competence has kind of already happened. So it's kind of moot, that point, as of now. But I think that question about safeguarding is very important, because even though the partner is of her same age, you're trying to understand, was she coerced into this? Was she forced into this? Was she abused? Even if they were of the same age, you're still trying to understand, was it something that was forced onto her? Right? Was it a mutual decision, or was it something that she was forced for? Because then that is what you actually have to safeguard for. As soon as you understand this is an abuse case, then you start involving people. At this point, you have no indication to show that this was an abuse case. She also went like, no, it's my boyfriend, and this was a mutual decision. Right. So at no point do you actually get an indication that this was an abuse case. So nobody is in danger. This has happened, right? Now, from now, how do we take this forward? Right. So now that's why you're trying to give her the decision, saying that if you want to make it, if you want to be, if you don't want to share it with people, because another thing, you're not trying to cause her any mental stress or strain. right? You're trying to keep her healthy mentally, physically, and every other way possible, right? So that's why you are trying to direct her into, taking the most comfortable route according to her. If she feels talking to her parents is the support that she requires, encourage that. Encourage at every point. Do not force. It's patient autonomy is of very high consideration over here. You do not breach patient autonomy unless you feel they are in danger. At this point, if you start feeling they are in danger, then you need to start involving people. At this point, they are not in danger. This has happened. Now you're giving them an option to continue in the safest course that they feel, right? You are providing them resources so that they can do it in a confidential way. That is exactly why these services are available, and the confidentiality around them also is available, right? If at every point you are encouraging them to open up to their parents but not forcing, need to understand that fact. You need to give them autonomy. That's exactly why you ask the parents to step out, so that they can trust you, they can continue to trust you, right? So that goes into the whole lines of ethics. You need to build patient trust in order to treat them, right? Does that answer your question, doctor? Also, it's been 2 hours in this one case, but I think this one case I think raised a lot of doubts, and I think all the doubts were relevant. There weren't any bad questions. We got a lot of conflicting information, that we need to address, and we understood a little bit about it. I will do a little more research, and I'll find out the aspect about GILIC competence. From my understanding of GILIC competence, I think I explained to you the situation according to my understanding of GILIC competence, but I'll do a little bit more research and find out if there is anything more. If there is anything more, I will post it on the group, and you guys can give your opinions there as well. Yeah, feel free to share your opinions. That'd be great. I'm going to ask the examiner to post our WhatsApp group link again. If you guys are not already a part of our WhatsApp group, please do join in. All our discussions. We'd always love to have opinions, other opinions, to actually understand what are the different kinds of opinions that could be associated with this case, because there might be so many people thinking about this. So definitely go ahead and ask your questions. All right. So finally, let's just go to the interpersonal case. So finally, offer leaflets. We went with follow-up, safety netting, return to seek help if symptoms worsen, any new symptoms appear, or she feels emotionally overwhelmed, right? Documentation, very important, especially when you're talking to underage child. Definitely document, right? Tell them about the documentation that you're doing, and that all the things that you have offered to them, right? And their decision, if that is something that they're making at the moment. But tell them that this is something you need to take time. Don't worry, take your time, and as soon as you're ready, we will explore the options and move forward with your decision. All right, interpersonal skills, maintain calm, empathetic, and non-judgmental language throughout the consultation. Ensure clear, direct communication and avoid medical jargon. Ensure confidentiality, reassure her that what she shares stays private unless there is no serious risk. Unless there is a serious risk, I'm so sorry, yeah. Unless there is a serious risk. Use gentle, non-judgmental tone when discussing sexual history and pregnancy diagnosis. Always assure patient confidentiality and validate her concerns. Be prepared to provide information about confidential services like NUPAs. Encourage support-seeking behavior. Offer information about counseling and support groups for young people facing unplanned pregnancy. Yes, and that's your score for the second attempt. And yeah, still a lot of room for improvement, but good job, Dr. Arusa. All right, so finally,
Please like and subscribe to Turing Med School. Good luck with your preparation.